Hey, how's everyone doing? How are you out there? Thanks for joining another video. My name's Erin Gallardo, and I am one of the co-founders of the Neuro Collaborative. And joining you this afternoon to talk about another cool topic that we get a lot of questions about and that we love discussing and diving into. Lots of good things coming out of the neuro community. So happy to join you today and delve into something else that is really interesting and hopefully really interesting to all of you. So this topic's really interesting to me because I've been involved in developing neuro wellness programs for a number of years. So that's what we're going to be talking about today, neuro wellness programs and what our role is as a physical therapist, what's our number one challenge around offering neuro wellness programs, something that I see a huge challenge for us therapists. And we're going to differentiate between therapy and wellness a little bit. So definitely want to stick around to hear the whole discussion and conversation. And if any of you out there are already doing neuro wellness programs, or maybe you're thinking about doing one and you have some questions, I would love to hear from all of you. Any suggestions, thoughts, pointers, questions, things that come up for you, definitely feel free to jump in there and send them out here so we can continue the discussion. So let's talk about first, like, why wellness is important in the neurologic population. Really obvious, I feel like, but people with neurologic conditions, they need exercise just like all of us. They need to be able to prevent secondary conditions, weakness, pain, things like that. But a challenge with people with neurologic conditions is that they move differently a lot of times. They may be less active. They may have other medical conditions that make going to a gym or a typical health care provider who serves the general population, maybe it's not possible or ideal at all. Hi, Brian. So this is why, as physical therapists, we're really in a great position to be able to offer wellness to the neurologic population, right? We have knowledge and background in neuroanatomy, neuropathology, movement science, exercise prescription, all these things as it relates to a neurologic population. So we're definitely ideal when it comes to providing safe and effective wellness programs for the neuro population. But this is where it gets tricky, and why I wanted to bring this up today for us to talk about and have an ongoing conversation about, because we kind of have to differentiate when we're doing physical therapy and when we're doing wellness. And why do we need to do that? Well, the main reason we really do need to differentiate the two is that most insurances don't pay for wellness. And if you're a physical therapist who's working in a place that accepts insurance, you need to differentiate whether you're doing wellness or whether you're doing therapy, because you're going to bill insurance for your therapy, but you're going to charge cash for wellness. And maybe there's places that can't even do that yet. So that's why we have to differentiate between the two. You can't be billing insurance for something that is not covered. And the other reason that it's really difficult and needed to differentiate for the neurologic population, this is kind of unique compared to doing wellness in the able-bodied population, is because a lot of our patients with neurologic conditions are also Medicare beneficiaries. And even if you're a non-participating provider with Medicare, you still have to be very careful about what you provide to that beneficiary, and whether it's therapy in a covered service or whether it's wellness. You still need to know what you're doing and the difference and follow their rules, even if you don't accept Medicare. And Medicare is just a crazy topic and something that's always coming up as just confusing and frustrating in a lot of ways for us neuro providers. So it's a little bit too in-depth and long to go into for today's talk, but definitely something that we're going to continue to explore and discuss with you all, because I'm sure you all have questions around that ongoing as well. But anyways, the main point is that you're not going to be charging cash for a Medicare beneficiary when you're doing physical therapy, but you will when you're doing wellness. So you need to know whether you're doing one versus the other, and not to try to complicate it too much for the patients and for each other, right? So I'm going to give you 3 ways to help distinguish and differentiate when you're doing wellness versus when you're doing therapy, because it is really gray. And even if we set up these rules and guidelines that we're going to try to follow, there's always going to be questions and gray areas about it and up for debate. So just to give a few guidelines around how this can help you distinguish between when you're doing one versus the other, I'm going to go through that. So first one, wellness is beneficial, but it's not considered, quote, medically necessary, whereas therapy is both beneficial and medically necessary. So that's a distinction. People need both. They oftentimes need both physical therapy and wellness, but the medical necessity part is what distinguishes wellness from therapy. The next point, wellness is fitness and exercise that may be performed with the guidance of another person, whereas therapy requires therapeutic skill. So this is a question that you're always going to be asking when you're delivering services for people is what I'm doing requiring therapeutic skill, or could this be done by another person? Am I just guiding them through something that's not necessarily skilled? That does get really gray, but it's something you want to really investigate when you're working with someone. The next pointer is to differentiate. Wellness goals are related to improved fitness, flexibility, and overall well-being, whereas therapy goals are related to specific functional tasks. So people are going to have goals about their wellness. I have goals about my wellness, and that's important. You want them to have goals, but what you're going to be listening for when you're interviewing your potential patient or client, or when you're trying to think about your plan of care, what are they saying they want to accomplish? And does it sound more in the realm of fitness, and they want to get back to tennis, they want to get back to golf, some recreational thing that's more wellness-based? But if they are talking about specific functional things, like transfers or bed mobility, stuff like that, then it's going to be more therapeutic based. And this is going to take some investigating with your patients. It's not like they're going to come out and say, and you're like, done, easy peasy, this, that, and differentiate it. But investigate that and just be really curious and honest about what you're hearing from them and which parts would be considered medically necessary, skilled therapy, and which parts might be considered more wellness based. So Brian, you asked a good question. Can you start your wellness simultaneously with PT treatments? I would answer yes, absolutely. And it's going to depend on the person and what they need and what they're working on, and also what type of wellness they're interested in or what wellness you provide. So for example, if you have group classes and you're working with a new patient on therapeutic goals, and they're still not at a level where they could participate fully in the group class because they're not strong enough to get up from the floor, or there's still a pretty big falls risk, they may not be appropriate for the group class yet. But if they have wellness goals and you have a wellness program or one-on-one wellness that fits with their wellness goals, and they have therapy goals, you can absolutely have them do therapy and wellness simultaneously on different days. But yeah, it's a really good question. Okay, so those are the 3 things that I would use to help differentiate between when you're doing therapy and when you're doing wellness. And we hear a lot of confusion and conflict around those things because can be such a gray area. And so this is just, honestly, it's going to be ongoing discussion, and everybody can have an opinion about when they think one or the other. But I think over time, it starts to get a little bit easier to distinguish between the two. And honestly, the biggest challenge that I see, and that probably many of you are faced with when deciding when things are wellness or therapy, it really comes down to money. And money is a really hot button issue with therapists. And I honestly think with all of us humans, we have beliefs around money, and we have fears and things that feel very true about what we think about it. And when it comes to wellness versus therapy, what's behind this is that wellness is something that people pay for. And therapy in general is something that's covered by insurance. Not always, because there's definitely, we have out-of-network patients as well and cash patients as well. But one of the big pieces that becomes very tricky with a lot of therapists is talking about money and our beliefs around it. So a lot of us are really scared to ask for money. We bring our own money biases into the business, and we bring our own insecurities about our self-worth and our value into that conversation. We assume the neuro population can't afford to pay for things out of their pockets. And so I'm just throwing these things out here because this is what I hear a lot of, and these are definitely struggles I've had myself and questions I've had. And it doesn't mean that they're always false or they're always true. It just means these are things that come up, and can we actually ask these questions and explore and see what's really in that? Is this actually true, or does it feel true, but it's actually just a belief? And this is really the big reason why we need to distinguish between when we're doing therapy and when we're doing wellness, because we want to get to the bottom of this fear and our scarce mind around asking for money. So, you know, bleeding heart therapists that we have a really hard time with it, and we want to give everything away for free because we feel bad and we're good at it. It's kind of easy, like, oh, I'll just do it for you, like, it's fine. I don't want to ask for money. But honestly, with that mindset, it's not helpful. You're really not helping your patients or clients by going into these things assuming that they can't afford it, they wouldn't pay for it, they don't want to prioritize it. You really want to investigate if some of those things are happening for you around asking for people to pay for what you're providing to them. Because what we've seen and what's really true about a lot of us is that the transformation comes in the transaction. So when we get something for free, we don't value it as much. We don't appreciate it the way we appreciate something that we've actually paid for and that we're invested in some way. So we take things more seriously when we actually have some skin in the game. And I know personally for myself, I've signed up for a bunch of courses and webinars and things that are free, and I'm interested in doing it and I want to do it. But if I didn't pay for it, I almost never end up attending because something else will always come up during that time when I was going to do it, and I miss out. But if I paid for something and I'm invested in it, then I definitely know I'm going to attend and get something out of it. The same thing happens with our clients. And now I'm not saying that it's never true that people can always afford what we're doing and they can always pay out of cash, but pay cash out of pocket. But it's really important for us to investigate if we're bringing our own biases around money into what we're providing people and into our programs. We're a really creative bunch. We're very resourceful. I know all of you, not all of you, I know many of you so well. I know our kind, and we figure out how to make things work, and we're going to figure out how to create sustainable programs and not lose money. But it's really important to have this conversation because our instinct is to set up something that is very affordable or too affordable or something that we can't even make a profit on. And when we don't even have something sustainable, you can't keep it going. So how can you help more people if you can't even keep your program going because you don't charge enough to cover your costs? So this is a big conversation, honestly, too, just around value of therapy and therapists that I could go on and on about. But what the challenge is for people who want to do wellness is around asking for money. And I am going to say the first thing you should be leading with when you're going to be creating a wellness program, or if you want to put something out there, do not necessarily lead with the assumption that no one can or no one is willing to pay for your services. If you go into, I want to create neuro wellness programs, but no one can pay for them or no one wants to pay for them, if you start with that, you're going to find more and more evidence why that's not true, and you're just going to have a self-fulfilling prophecy, and you're not going to have a program that actually succeeds. And I don't want you to do that because people need you and they need your services, and you're worth so much. So don't go into it assuming that they can't and won't pay for it, okay? What you want to do is, before you even start thinking about your wellness offering, or considering like what it's going to look like and be, identify your own biases and beliefs around money and start to ask yourself those questions. What's true for you about money? What feels true? And just be curious about it, not judging and not being mad at yourself, but just be very curious what things might come up. So some things that people might think about money and have beliefs around it that feel very true is money is evil. If I'm asking for money, I'm greedy. Asking for money from these people is unethical. So maybe some of these things have come up for you before around money. So just kind of observing that. And if that's something that you've noticed in yourself and something that's scary for you, these things, you didn't put these thoughts and beliefs and quote truths into you. They were built into you over time and from people in your life and from things that you learned and heard over and over again. So it's not your fault that you think these things, but it would be very helpful to explore them and identify what is there and what sort of crept in, so you can start to uncover it and see, is this belief really helping me and serving me? And is this belief actually helping the population that I want to help? Like, am I actually able to help them more? Or is this belief creating a scarcity and limitations and basically a dead end for what I can do for people? So that is what I really challenge you all to start to investigate. You know, when it takes a long time to really work through these, honestly, I have not worked through it myself either. I have a lot of beliefs and assumptions around money still, but I work on it. And you can start, once you can start charging what you're worth and really believing in what you're doing and the results you're providing for people, then you're gonna actually start seeing your clients getting better and better and better. This has absolutely been true for what we've seen in our practice. When the clients are invested and they have more things to invest in their self and their health, they're getting better and better and better. And we're still providing and finding other ways for people who literally cannot afford the services to join in and have the benefits as well. So you want to start at least with your value, what you're providing, questioning your assumptions, and then starting your program by empowering people and teaching them about how investing in themselves can really help them achieve all the goals that they want to achieve. And then you can start to go into ideas for how to make things more accessible to those who cannot afford it. Because truly, for the case for most of us and our clients too, it's not always about affording. A lot of times with money, it's also about prioritizing. And what do you prioritize? There are clients that we have that if I were to guess right off the bat, be like, nope, they can't afford wellness because of this, and this reason based on their financial status or insurance status. And then you end up finding out that that's not true. They highly prioritize it, and they are going to pay weekly for multiple different wellness services because they understand the benefit that it provides. So you don't always know who can afford it and who can't afford it, and who's prioritizing it and who's not. So in summary, neuro PTs, we have a very useful place in providing wellness for the neurologic population. And we should be developing programs to help promote and encourage that continued recovery, reducing falls, reducing comorbidities, and improving quality of life. Huge, huge aspect of what we can do for this population. So first, you really want to figure out what patients, who you want to work with, what population when you're doing wellness, and differentiate when you're doing wellness versus skilled therapy, and what you're going to do to help these people, one-on-ones, groups, things like that. And Claire's going to talk about different business models on another video on Thursday. So identify your patients, differentiate when you're doing wellness and therapy, and then the next aspect would be to identify your beliefs around money and explore with curiosity and openness how they came into play, and how they come into play with when you're creating something like this. How does this affect you and your clients? And how is this assumption or these beliefs, how is that influencing your decisions? And if you heard my last video last week talking about the things to ask yourself when you're going out on your own or starting a side gig, the big question is around your why. And so I know I'm talking about money right now, but I'm not talking about you're only going to be starting something like this because of money. because that's not really where most of us are driven anyway. So I don't really suspect there's a lot of people thinking like, yes, I'm doing this to get rich. But you're going to identify and question your thoughts around money, but not because you're only driven by money and all your decisions are based around money, but because you need to investigate whether this is limiting you and limiting your impact in what you can help people achieve. They need that transaction, they need that investment, and they need your expertise and skills. You don't want to create a place where you're resentful, where you're overworked, where you're overburdened, where you burn out, right? So this is why this is really important to investigate. So any other comments or questions, please throw them in there. We can continue the discussion after this video is over, and would love to hear from all of you. Thank you for joining and contributing today. Be sure to join our mailing list. Go to our website, neurocollaborative.com, so that you can get all of our latest updates and resources, and you can learn more about our power group, the Neuro Tribe. So our Neuro Tribe is awesome and amazing. We are just loving working with our group. We have an amazing group of like-minded, passionate neuroprofessionals, and they're looking to advance their career, to maximize their impact. We're opening the doors for our Neuro Tribe again on March 25th. So this is a group that we only open a couple times a year, get people in and really help them carve out those dreams and visions and the career that they desire by working together collaboratively with other like-minded, passionate professionals. So if this sounds like something really cool for you, which it is, I'd encourage you to go to our website, neurocollaborative.com, and click on Neuro Tribe to learn more about it and get on our wait list. Our Neuro Tribe will only be open for 4 days, and it starts on March 25th and will close on the 28th. So just keep paying attention to what we're putting out there, and definitely ask us questions. Anything you have or thoughts you have around that, we wanna be able to answer those questions and help guide you on whether it's the right choice for you or not to be involved in our group. So thank you so much for joining, and please keep the discussion going. Join Claire on Thursday at 6 p.m. Pacific time for another video discussion. She's going to be talking about different neuro PT business models, so that should be a really great topic. So yeah, thank you for joining, and I hope to hear from all of you soon. Bye.